One way to quantify progress during physical therapy is to monitor the strength of patients using FoSe data. This data is usually acquired from handheld dynamometers or a biodex or other device. At the University of Pittsburgh, we built a prototype for an alternative device. It's called FoSe, short for force sensor. It's portable for clinical use like a handheld dynamometer, but it can also be used at home to track patient progress in between clinic visits. Here are some of the basic components for the device. The sensor is connected by a strap to a door anchor. An ankle strap can be used for lower body exercises, while a handle can be used for upper body exercises. An additional strap can be used to customize the length of the device as needed. The device must first be anchored to a rigid surface. In this case, a door is being used. A handle can then be attached in order to perform the specified isometric exercise, in this case, internal shoulder rotation. While the patient is positioning themselves, the physical therapist can open up an Android application on their tablet in order to track the progress. Opening the FoSe app instantly brings up a force readout screen, where you can watch force exerted over time. Pulling from the side reveals a main menu with a variety of options, including instructions for how to perform different isometric exercises, history files of previously recorded force data, and settings for specifying the joint and movement that the force data corresponds to. Pressing the Bluetooth button searches for the device. Pressing the device name connects the tablet to the force sensor, after which the exercise can begin. Data is collected in real time as the patient flexes for a specified amount of time. Additional flexions can be performed depending on the level of clarity that is desired. Afterwards, the data is recorded and summarized in a single results screen. It includes the graphs from each trial, their respective maximum forces, an overall average maximum force, and the coefficient of variation between results. The joint, movement, date, and time are also recorded for reference. FoSe is flexible. It can be used to measure force for a variety of isometric exercises. Simply turning around can enable external shoulder rotation. The handle can be switched out for the ankle strap to enable lower body exercises. Here, the user can first adjust the device and perform hip abduction. Similarly, turning around can enable hip adduction. By sitting in a chair, the user can also measure how much force they can exert by knee flexion. Turning the chair around can accommodate knee extension exercises as well. Here are the results for a right knee extension. If you'd like to compare the right knee with the left knee, simply press the Compare button. This feature will overlay results between the corresponding joints. The graphs illustrate any visual disparities. Numerical differences are also highlighted in the results below. Any two joints can be compared. Pressing the file name allows the user to pull up different result files. If additional monitoring of patient progress is desired, the patient can be sent home with the sensor and an Android device to perform isometric exercises between visits. Because the device can be anchored to any number of rigid surfaces, the patients can use the device on their own at home. Additionally, the data can be saved and sent to physical therapists remotely. In a future version of FoSe, clinicians will be able to use a web interface to see all of their patients with summary data. This can enable clinicians to gain a better sense of patient progress and compliance with prescribed exercises. For patients, being able to quantify and see their own progress can be satisfying and encouraging to continue with their therapy. We have a few questions for you about this device, and we'd greatly value any feedback that you have for us.